Many people over the age of 60 are told that their blood pressure is normal, but despite that, they still feel dizzy, tired, or simply not quite right. And this can be confusing, because if the numbers are normal, why does the body feel off? The truth is, blood pressure is not just about a single number. It is about how well your body regulates circulation throughout the day. And after the age of 60, this regulation becomes slower and less stable. So even when your readings appear normal, your body may already be showing early warning signs. In this video, we'll walk through 7 subtle signs that your blood pressure may be affecting your body more than you realize. The first sign is morning dizziness. Many people notice that. When they first wake up and try to stand, they feel lightheaded or slightly unsteady. This happens because your body is transitioning from a resting state to an active state. During sleep, your blood pressure is lower and your circulation is more relaxed. When you stand up, your body needs to quickly adjust to keep blood flowing to the brain. But after 60, this adjustment can take longer. So for a brief moment, your brain may receive less blood flow than it needs, and that can cause dizziness. The second sign is a general feeling of being off. Not exactly sick, not exactly tired, but not quite normal either. This can include mild fatigue, slight brain fog, or a sense that your energy is not stable. This happens because your blood pressure regulation is not responding as smoothly as before. Your body may be experiencing small fluctuations in circulation that are not large enough to show up clearly on a single measurement, but your brain and muscles can still feel the difference. The third sign is cold hands or cold feet. This may seem unrelated at first, but it is often connected to circulation. When blood pressure regulation is not optimal, your body may prioritize sending blood to vital organs, like the heart and brain. As a result, less blood may reach your hands and feet. This can lead to a persistent feeling of coldness, even in a comfortable environment. The fourth sign is mild pressure or discomfort in the head. This is not usually a severe headache. Instead, it may feel like a subtle heaviness or pressure, especially in the morning. This can be related to changes in blood flow and vascular tension. As blood vessels become less flexible with age, they may not adjust as efficiently to changes in pressure. This can create a sensation of discomfort, even when readings appear within a normal range. The fifth sign is sudden fatigue after standing or walking. Some people notice that. They feel fine while sitting or lying down, but become unexpectedly tired after standing or moving. This can be linked to how your body manages circulation during activity. When you stand, your cardiovascular system has to work harder to maintain stable blood flow. If this adjustment is delayed, your muscles and brain may receive less oxygen temporarily, and that can lead to fatigue. The sixth sign is waking up during the night, especially around 2 to 4 a.m. Sleep disruptions can have many causes, but changes in blood pressure can be one of them. Your body follows a natural rhythm over a 2-4 hour cycle. Blood pressure typically drops at night and begins to rise again in the early morning hours. But after 60, this rhythm can become less consistent. Some people experience unexpected fluctuations during the night, and this can cause brief awakenings or restless sleep. The seventh sign is fluctuating blood pressure readings. You may notice that your readings vary more than expected. Sometimes they are normal, sometimes slightly high, sometimes even lower than usual. This variability can be a sign that your body is having difficulty maintaining stable regulation. Instead of a smooth and controlled pattern, your blood pressure may be shifting more than it should. And over time, this instability can place stress on the cardiovascular system. So why do these changes happen after the age of 60? There are several reasons. First, blood vessels gradually become less flexible. This makes it harder for them to expand and contract quickly in response to changes in position or activity. Second, the nervous system that controls blood pressure becomes less responsive. This system is responsible for making rapid adjustments when you stand up, move, or change posture. But with age, these responses can slow down. Third, circulation itself may become less efficient. The heart, blood vessels, and regulatory systems all need to work together And when that coordination is slightly delayed, you may begin to notice symptoms, even if your readings still appear normal. The good news is, there are simple ways to support better stability. Start with your morning routine. When you wake up, avoid rushing out of bed. Seat for a moment, take a few slow breaths. Allow your body time to adjust gradually. Stay hydrated. Even mild dehydration can affect blood pressure regulation. Drinking water in the morning can help support circulation. And when changing positions, move slowly. Give your body time to adapt. These small habits may seem simple, but they can make a meaningful difference in how you feel each day. Finally, it is important to know when to seek medical advice. If you experience frequent dizziness, fainting, chest discomfort, or significant changes in your readings, you should speak with a healthcare professional. Because while these signs can be subtle, they can also provide valuable early insight into your cardiovascular health. Blood pressure is not just a number. It is a dynamic system that reflects how well your body is adapting moment to moment. And after 60, understanding these subtle signals becomes even more important. By paying attention to how your body feels and making small adjustments to your daily routine, you can support more stable circulation and better overall health. If you found this helpful, consider subscribing to Senior Health Explained, where we break down complex health topics into clear and practical insights for everyday life.